Hello everyone, welcome to the video on GPAT Crash Course MCQ series. In this video, I am going to explain previous GPAT Pharmacology questions with answer explanation, and this is part 6. All the questions are from previous GPAT question papers. This is my YouTube channel. If you like the video content, subscribe and share the content. Let's get into the topic. Now, proton pump inhibitors are the most effective when given. Now, proton pump inhibitors, their main job is to treat peptic ulcer. Now, the mechanism of action of proton pump inhibitors are, as the name indicates, they inhibit proton pump so that H plus will not get into the stomach and HCl formation is inhibited. So, in order to show the action, before forming this HCl, these drugs has to be administered. When HCl forms, when we take food. So, after taking food, it won't help because already HCl is formed. So, these drugs has to be taken half an hour before meals so that HCl formation will be inhibited. Omeprazole, esomeprazole, pantoprazole, all of them belong to this category. So, the answer is half an hour before meals. Now, match the compounds in group 1 with inhibitory activities in group 2. Now, vancomycin is a cell wall synthesis inhibitor. It is an alternate drug to penicillins and it is also used to treat pseudomembranous colitis. Now, rifampin or rifampicin is a drug of choice which is used to treat tuberculosis and it inhibits RNA synthesis. It inhibits a particular enzyme known as RNA polymerase. Puromycin, it inhibits protein synthesis. It is used to treat bacterial infections. Ciprofloxacillin, norfloxacillin, ofloxacillin, all of them belong to urinary tract infectants and they inhibit DNA synthesis. They inhibit a particular enzyme known as DNA gyrase. So, all these drugs are antimicrobial agents and their specific mechanism of action. So, let us see the P goes to 5 and then Q goes to 4. So, option is this one. And puromycin R, protein synthesis inhibitor, ciprofloxacillin, DNA synthesis inhibitor. So, the right answer is option A. Moving to the next one. Now, drugs used in ventricular arrhythmias. See, while treating arrhythmia, you have two types are there. Ventricular arrhythmia, supraventricular arrhythmia or atrial arrhythmia. Now, in the choices given, verapamil, esmolol, diltiazem, all the three are used to treat supraventricular arrhythmia, whereas flecainide is a drug of choice to treat ventricular arrhythmia. So, option A is the correct one. Moving to the next one. Now, the lipoprotein with the fastest electrophoretic mobility and lowest triglyceride content is. See, lipoproteins we have LDL, VLDL, IDL, HDL and chylomicrons are there. Among all of them, the lowest triglyceride content is there with HDL. HDL is also known as good cholesterol. It takes cholesterol from extrahepatic tissue and transfers it to liver. So, that is the reason why it is called as good cholesterol, whereas LDL is known as bad cholesterol because it transfers cholesterol from liver to extrahepatic tissue like blood vessels, and that is what causes atherosclerotic plaques and everything. So, LDL is called bad cholesterol. Among all of them, the lowest triglyceride content is there with high density lipoprotein. So, option B is correct. Moving to the next one. Now, all adrenal gland overactivity disorders except. Now, see, this is an interesting one. See, this Addison's disease occurs because of reduced levels of cortisol. The question asks about overreactivity, whereas Conn's disease is due to aldosterone extra secretion. Higher levels of aldosterone is what causes Conn's disease, whereas Cushing's disease, increased levels of cortisol is what causes it. See, syndrome disease, both of them are similar one. Multiple symptoms are there, then it becomes syndrome. This is a single kind of symptoms will be there. So, answer for this question is except, see, all of them are hypersecretion of adrenal gland. Only one, Addison's disease, is because of reduced secretion of cortisol. So, option A is correct. Moving to the next one. Now, drug of choice to treat H1N1 influenza. Now, all of them are antiviral drugs. If you see them, edofovir, cidofovir, tenofovir, all of them are very selectively used to treat hepatitis infections. Whereas influenza is selectively treated by oseltamivir, zanamivir kind of drugs. Now, Tamiflu is a derivative of this one. So, oseltamivir is a drug of choice to treat influenza virus. Moving to the next one. Now, again, see, match the scientist awarded with Nobel Prize with their contribution. Now, Alexander Fleming, we all know he discovered penicillin. Now, Brain Kobilka is responsible for the research on G protein coupled receptors. Now, Banting, Best are the one who are involved in insulin discovery, whereas Black is responsible for beta blocker activities finding. So P goes with 3. Now we need to look for this one. So P goes with 3. Q, Brain Kobilka is GPCR, Banting is insulin, Black is for beta blocker. See, the advantage with this kind of multiple choice questions is, look at the options. If you know Alexander Fleming is related to penicillin, you can straight away get the answer. You don't need to know all of them. So there is always an advantage with this kind of questions. If you know 1 or 2, you can get the answer correctly. Moving to the next one. Now, which diuretic causes decrease in release of insulin? See, thiazides are notorious for this. Now, the reason for this is thiazides will worsen diabetes mellitus condition. Now, what happens is most of the time it is due to their effect on potassium levels. Thiazides will cause hypopotassiemia. So potassium levels will get reduced, and that is what interferes with the release of insulin. So by providing potassium supplements, this condition can be handled. But the answer, which diuretic causes decrease in insulin release, means it is thiazides, chlorothiazide. Moving to the next one. Now match the following drugs with mode of action. Again, methotrexate. Methotrexate is an anti-metabolite. To be specific, it is an antifolate. Cyclophosphamide is an alkylating agent. Vincristine, mitotic inhibitor, whereas dactinomycin, intercalating agent. So P goes with 2. You see, P goes with 2 options are there, whereas cyclophosphamide, alkylating agent. So this is the correct answer. See, by knowing 2, you can get the answer correctly. Vincristine, mitotic inhibitor, dactinomycin, intercalating agent. So this is the answer. Moving to the next one. Now, aim of pharmacovigilance. Vigilance means monitoring. The major aim of pharmacovigilance is to monitor drug toxicity. Next one. Phase 0 studies is an. See, phase 0 studies is carried on very few population, like 10 to 15 volunteers, and very small doses are given to find out the toxicity of the drug. See, this is called as phase 0. We know about phase 1, 2, 3, 4. But phase 0 is done before all these things to confirm the toxicity, and very small amount of doses is given in very small population. So they are known as human microdosing studies because of small doses. Going to the next one. Now, agelosilin, megelosilin, piperacillin, all these are uridopenicillins. They have broadest spectrum of activity. That superior activity is because of improved penetration through cell envelope. They have very good penetration. Because of that, they have broadest spectrum of activity. Moving to the next one. Which of the following drug is used to diagnose myasthenia gravis? Myasthenia gravis is an autoimmune disorder wherein nicotinic receptor number is reduced. To treat that, acetylcholine levels are increased by giving acetylcholinesterase inhibitors. See, for treatment you can use neostigmine, pyridostigmine, physostigmine. For the question asks about diagnosis is by edrophonium. Edrophonium T-half is very less. It acts only for 5 to 10 minutes. When this drug is given, increased motor activity is seen. If because of the drug increased motor activity is seen, then it is confirmed as myasthenia gravis. So this is what is the answer is. Going to the next one. Now, antidiabetic action of glyburide at molecular level is by which mechanism? Now, these are sulfonyl ureas. Now, all sulfonyl ureas will be acting on a receptor known as sulfonyl urea receptor. Now, the sulfonyl urea receptor is nothing but potassium channel, potassium ATP channel. On the cell, you have potassium ATP channel is there. When this channel is inhibited, inside the cell, depolarization occurs. When this depolarization is occur, calcium levels are increased, and that is what causes release of insulin. So this is how sulfonyl ureas act. Sulfonyl ureas, they release insulin, hence they are known as insulin secretagogues. How do they act? They act on sulfonyl urea receptor by inhibiting potassium ATP channel, which causes depolarization, increases calcium level, and that is what releases insulin. So how do they act? See, look at the options. You have 2 options related to potassium efflux is there. By blocking this potassium channel, potassium efflux is decreased. So decrease in potassium efflux. You need to be careful with the options. So this is the answer. It is not increase in potassium efflux, it is decrease in potassium efflux. Moving to the next one. Now, blood sugar level is well controlled when hemoglobin A1C is. See, this is known as glycosylated hemoglobin. glycosylated hemoglobin. What happens is when blood has got a lot of amount of glucose, the glucose will combine with hemoglobin and forms HbA1c. That means glycosylated hemoglobin. This is a very good measure of past 3 months glucose levels. Usually the normal control is to be between 5 to 7%. So well controlled means it has to be below 7%. So this is the right answer. Moving to the next one. Now, which of the following diabetes drugs acts by decreasing the amount of glucose produced by the liver? So from the liver, if from the liver glucose release is reduced, that means increasing cell sensitivity towards insulin. So these are known as insulin sensitizers. Insulin sensitizers are biguanide like metformin drug. Remaining all, sulfonyl urea is an insulin secretagogue. Meglitide, insulin secretagogue. Alpha glucosidase inhibitors, it acts in the gut, inhibits this enzyme so that glucose metabolism is reduced. So the answer, the amount of glucose produced by liver is decreased by biguanides, metformin kind of drug. So option C is correct answer. Moving to the next one. Now, Vigabatrin is a GABA analog that potentiates the action of GABA in the brain because of. What happens is Vigabatrin is a GABA analog. It inhibits GABA transaminase enzyme. The job of GABA transaminase is GABA is metabolized to semi-succinic acid, semi-aldehyde succinic acid. It is, see, the amine is transferred and it is metabolized to succinic aldehyde. So this metabolism is inhibited by Vigabatrin. So what happens? GABA levels are increased. So what is the answer? It inhibits GABA transaminase enzyme used to treat epilepsy kind of diseases. Moving to the next one. Cyclic AMP is an important second messenger. It is generated by which enzyme? See, cyclic AMP is generated by a particular enzyme called as Adenylate cyclase. This is what forms cyclic AMP. See, guanylate cyclase forms cyclic GMP, whereas cyclic AMP phosphodiesterase, it breaks down the cyclic AMP. It is a metabolizing enzyme, whereas protein kinase causes phosphorylation of proteins. So option D is correct. Adenylate cyclase is responsible for forming cyclic AMP. Moving to the next one. Now, hypersensitivity type 1 exhibit all except. See, hypersensitivity type 1 is an allergy mediated reaction. It is mediated by IgE. On the mast cells, IgE attaches and it releases a lot of histamine, and that is what causes allergy. It occurs immediately. Atopic means sensitivity towards allergy. All of them are true. What is except? Except is this one, exemplified by tuberculin test. This is specific for type 4 hypersensitivity reaction, which is nothing but delayed hypersensitivity. So this is not related to type 1 hypersensitivity. So the question asks about except, so answer is exemplified by tuberculin test. Moving to the next one. Now, which of the following is a necessary cofactor in the formation of blood clot? We need to understand what you mean by this cofactor is. See, enzymes like holoenzymes will have a lot of components. Enzymes has got a protein part and a non-protein part is there. The protein part is known as apoenzyme, whereas non-protein part is known as prosthetic group. Now, in that prosthetic group, again you have organic groups are there and inorganic groups are there. Now, organic part is known as coenzyme. Most of our enzymes, B vitamin complex, acts as coenzyme, like thymine pyrophosphate is a coenzyme. NAD, FMN, all of them are coenzyme parts. Whereas cofactors are inorganic molecules like calcium, magnesium, selenium, and all of them. So in case of blood clot, the cofactor is calcium. So the right answer is C. So these are 20 question set from the previous GPAT related to pharmacology subject. If you like the video, share the video and subscribe the channel. Thank you for watching this video.